If you work in a PDR and you see an itty-bitty baby, like a month old or less, do you check the mother's blood pressure? I've seen at a couple different shops through my training. Primary care offices will go to barbershops, will go to local watering holes where people like to hang out, and they will do blood pressure checks, usually to capture communities that might not get access to care. Certain minority populations or populations that might be skeptical of physicians, reasonably so, because we tend to not treat people super well, given history. But that's a pretty chronic issue. If you are recently postpartum, you are still at a pretty decent risk of preeclampsia and eclampsia, up to 6 weeks or so after delivering a baby. And I wonder about the number of little kids I saw for first-time parents, and they come with a recently postpartum mother, and they're just scared to death of hiccups or reflux or spit-ups, or sometimes they're really sick and they have fevers and they need to be admitted for meningitis or sepsis or all these things. I don't think I've ever checked or asked to check the mother's blood pressure, and I wonder how many times it would have been high and the mother would have required treatment as well. Because I wonder what the number needed to treat in checking blood pressure to avoid an episode of hypertensive crisis or preeclampsia or eclampsia is in a newly postpartum mother who, if they are the one who brought the baby into the ER, might not have a lot of familial support. If they don't have familial support, they're less likely to follow up. It's a pretty at-risk population, if you think about it. Okay, yeah, someone do that study. Thanks.